Hello viewers. So once again we are back to Urologists on Air, and today we have a very prominent urologist all across from India, from Hyderabad. So before starting anything, I'd like to request you to please introduce yourself to the viewers.
I am Dr. Trivedi. I am a senior consultant urologist at Hyderabad at KIMS Hospital.
Okay, sir. So I'll be asking some of the questions related to a very important topic, which is related to urology, which is
Okay.
BPH. So first of all, sir, I'd like to ask you what is BPH, and what, according to you, why, according to you, the cases of BPH are on rise.
BPH is nothing but benign prostate hyperplasia. This is a
Yes.
condition which affects only men, and usually it happens after the age of 50. Just like there is a cataract which happens in the eye, at the same time the prostate also starts enlarging and it produces some symptoms which we will talk about, and this is referred to commonly as the BPH. So it is a age related process and a natural aging process.
What is the reason behind, like, these cases are getting high, like these cases are getting on rise? So what do you think the reason is?
Actually speaking, the cases are not on the rise, but there is more detection and there is more awareness. That is why we are picking up more numbers of BPH. So BPH, as I said, is a natural aging process which will happen to every man, but not every man will require the treatment. Some of them may not need any treatment, some of them may require only medication, and some of them may require surgical intervention.
Okay, sir, my next question is, why do you think that the cases of BPH should be detected at an early age?
Correct. The cases of BPH should be detected and they should be treated, because what I commonly observe in my practice is that the senior citizens, most of the times they try to neglect the symptoms, attributing it to old age, and many of them tell me that they don't want to bother their children and other people in the house. So my advice would be that whenever there is a senior citizen in the house, the family members like the spouse and the children should keep a watch that whether they are having any symptoms which they are not communicating, especially the senior citizen who is going to urination many times in the night, or somebody who is not able to hold the urine or immediately wants to rush to the bathroom when he gets the sensation. So these are some of the symptoms which should raise a alarm, and I suggest that you take the advice of a urologist, and once caught early it can be easily managed rather than neglecting the symptoms and coming to a stage where complications have happened, so that the management becomes more difficult and the changes of complications are also present. Some complications happen like the urinary tract infection because of an enlarged prostate, formation of stones in the bladder, and some other changes.
Sir, I'd like to add one thing. Why does surgical intervention become important, and can it be avoided?
Yes, the surgical intervention can be avoided if the BPH has been caught early and if there are no symptoms attributable, no complications which are due to the enlarged prostate. So once enlarged prostate is present and complications are not there, the first type of treatment would be with the medication.
Okay. So, sir, one last question to you. What kind of life modifications are important for the treatment of BPH? So, what would you suggest as a urologist? What would you suggest to the viewers?
The lifestyle modification is also one of the medical advice to the patients who are suffering from the symptoms related to an enlarged prostate. And in this lifestyle modification, there would be point number one, decreased intake of fluids in the evening time, so that they don't have to get up more in the night time to pass urine, which is a very bothersome symptom. Also avoid substances which cause diuresis. By diuresis I mean increase in the urine output, and increase in the urine output is caused by drinks like tea, coffee. These are the things which increase the urine output. So these are the main lifestyle modifications which are very helpful to relieve the bothersome symptoms which arise from an enlarged prostate gland.
Thank you so much, sir, for throwing the light of knowledge to our viewers. It means a lot. Have a nice day.